So we treated Amber for 10 minutes, and we had this foam 2-inch by 4-inch by 8-inch foam under the pelvis on both sides. We did that for 5 minutes, and we kept the foam under her for another 5 minutes while I put another piece of foam over the sacrum and just leaned very gently onto the sacrum. Did that for 5 minutes. So that is the simple, straightforward corrections. Diagnosing a movement dysfunction may be challenging at times, but treatment should be very straightforward and very straightforward. So now I can get some vertical force through the pelvis and get inferior mobility. I see your left heel bouncing. I can load your sacrum and I can spring it and get some mobility.
Awesome.
When I palpate your sulcus, I come onto the sacrum and I can now see the sacrum is deeper. So it really looks like it's been repositioned. And I realize the camera angle might not be optimal, but I'm on the sacrotuberous ligament. I can indent that now a little bit. Let's have you lie on your back.
Okay.
So you can see that it's easy to take up the slack through the pelvis, and it's easy for me to induce rotational mobility, and I'll do that on this side as well. And that's just a very different pelvis. I can side glide you right to left, and then I can spring it. There's a little bit more lateral translation. I'm not going to change the camera, but we did test your sternum earlier, and we found it to be rigid just below the manubrium, and now I can't even find that place, and I'm on your manubrium now. Remember we tested your neck?
Mm-hmm.
And you're very rigid at the OA joint.
Mm-hmm.
You'll notice I can easily lift your head up now.
Ah.
And I can traction you, and I see your whole body move. I see movement in your ankles.
Wow.
And then I'm coming on to C1 and testing side glide of C1, and that's very free. So we treated the primary pattern in the pelvis. The secondary compensations released reflexively.
Awesome.
So I don't need to do anything to free up T3, T4. I don't need to free up the OA joint, because that existed in response to a very rigid pelvis, and freeing up pelvic mobility corrected that. So let's have you get up and walk up and down the hall.
Okay.
And give us some feedback, and I'll move my camera and just keep your face out of it. We didn't look at you before walking. If we had, I think we would have shown a reduction in transverse plane mobility. But anyway, give me your thoughts.
Feels good. I can't tell if there's a big difference yet, but it feels good. Up here is noticeable.
Is that right? In the upper cervical?
Yeah, up in the neck.
What does it feel like there?
Just feels a lot looser, almost like I just got a massage here.
Uh-huh.
Yeah. Like
Very good.
Just lighter.
Nice. I
Which
mean,
is
I'll
good.
take that.
Yeah. Absolutely.
Very good. Well, I'm trying to document every case that comes in the door that has a posterior glide of the sacrum. Very little is known about it. It's a pattern I discovered, and it's not in any literature except in my book that I sell on Amazon and in my distance education course. So I just want to post more and more YouTube videos on this presentation and collect data. So thanks very much.
Absolutely. Thank you.